Tonight, we are talking about the Ebola virus. Our focus is on the facts, not the panic. We will look at how the virus spreads, the signs to watch out for, and how to stay safe. I am Olasumbo Mudupe. Welcome to the show.
We have completed a national risk stratification exercise, categorizing states according to the likelihood of Ebola importation on international points of entry, population mobility patterns, and border connectivity. This risk-based approach is guiding preparedness activities across the country. We have developed nationwide dissemination of Ebola case definitions, mostly to case managers like doctors, nurses, and people in surveillance areas. Case definitions, surveillance protocols, contact tracing procedures, and self-quarantine guidance, and traveler monitoring protocols to strengthen early detection and rapid response. While there are currently no widely available licensed vaccines and approved targeted treatments, specifically for this strain of virus, experience from previous outbreaks has demonstrated that early detection, rapid isolation, infection prevention and control, contact tracing, risk communication, and effective emergency coordination remain the most effective tools for preventing transmission and saving lives. We're encouraging Nigerians to remain calm. I say again, we do not have any case of Ebola in this country. They should remain calm and continue their normal activities. However, they should also obtain information only from credible sources. Avoid spreading rumors and misinformation. Practice good hygiene, the same thing IPC, hand washing, proper sanitation. These are key. And promptly report any unusual illnesses through established.
Joining us via Zoom to give an update on the current Ebola outbreak is Dr. Oladipo Kolawole, an Associate Professor of Infectious Diseases, Molecular Virology and Genomics from the Department of Microbiology, Adeleke University. He is also the founder, Helix Biogen Institute. Good evening, Dr. Kolawole Oladipo, and thanks for joining us.
Good evening. Thank you for having me on the program.
You are always welcome. What do you know about the ongoing outbreak in DRC and Uganda?
Well, for me, there is not much because we all know that there is an active outbreak of Ebola, particularly the Bundibugyo virus, which is less commonly seen compared to the Zaire one. And by May 15, 2026, I guess, it was reported in the eastern part of DRC, and that has spread rapidly in some other provinces. And number of cases have been recorded every time. There are some death cases, and also we've had incident of imported cases in Uganda, and which has been under control. And for now, we know that there is no approved vaccine for it, and there is no specific antiviral treatment. And where the outbreak is occurring is a complex setting, and that is one of the factors that earlier contributed to the spread, because the conflict zone, we have population displacement, we have mining areas, and this cross-border movement, that's what affected Uganda, because most of the cases recorded and reported in Uganda are imported cases of the Ebola. So I know that there are a lot of work going on by partners everywhere to ensure that they halt the spread of this pathogen.
Okay, The question on everybody's lips is, why are we seeing a rise in the outbreak of this particular disease? It will be recalled that sometimes last month we reported antivirus, coronavirus in April. Why are we seeing a rise in all these diseases?
Well, to me personally, we should see that it's a concern. It's a concern, but it is due to combination of both structural, social, and biological factors. And because, like I said earlier on, it's a conflict area. So, and when there is a conflict section in a place, you know that there's displacement, there will be overcrowding. So, and that population movement will be difficult to do contact tracing, isolation, and community engagement to be extremely uh, difficult. Then, because of porous border between DRC and Uganda, so that's why you can see imported cases being reported in Uganda. And also, there's what we call the weak earth system and delay detection, because the pathogen, the virus, that strain, has actually been circulating for some period before it was detected. So by the time the detection occurred, I think a quite number of people had actually be infected. Then there's cultural belief too. In that environment, they have some unsafe burial practices, and also in that of community too. You need to get contact. You have to. The virus can be transmitted to body fluid, so, and they have a way of washing the corpse, every other thing like that. Then because it is a conflict zone, if you see most of the videos we have seen outside there on some other news outlets, you can see that they have overcrowded health facilities. The few health facilities that are there have been overwhelmed by total number of people that are there. And there is a complaint that was lodged the other time by the health workers that are there, that has to do with IPC. That is infection prevention control, which is very poor. And that has to do with PPEs. Those are personal protective equipment like jackets, gloves, face masks, nose masks, every other things like that. And most of all these things are not being produced or manufactured in Africa. So, and that is one of the things that really, really affected it. Then, like I had mentioned too, there is no approved vaccine and treatment, specific treatment. So it's not like the Zaire one that. So the virus. They are not. The community, scientific community, were not actually hoping that this kind of Burgundio virus will be the one that will cause the pandemic now. So the virus took us by surprise. Then we have what we call seasonal and environmental factors. That's under climate change. So the dry season and mining activities in the region increases human to bat and human interactions, which are potentially facilitating spill over and spread. So also, there is something I noticed too personally, that is fatigue from previous outbreaks. When you have multiple outbreaks of uh, episodes of this Ebola, a time will come when this one is coming, everybody will just relax. I have seen a lot of things on television where some inhabitants of the community never believe that Ebola is real. They believe it's the Western people that brought in the Ebola virus to them. So fatigue has set in when people get used to something, so they don't care about it anymore. And that is very, very dangerous in a situation like this. And those are the things I can say about that.
Ebola disease is reported to be one of the most severe diseases. I think you should remind us about how it is spread, then the symptoms to look out for. If this will, enlighten more viewers.
Yeah, the truth about it is that if you look at the way it's being reported, we have suspected cases, we have confirmed cases. Uh, when we say suspected cases, like I used to say on my platform, that most of these illness comes with similar clinical signs, like fever, body pain. It is until when tiredness, it is until when it gets to the classic stage that you can be talking about bleeding from the nose, from the ear. So what we know is that once you suspect that you are not feeling fine in such endemic region, go to the nearest hospital, lodge your complaint, and let them take your blood sample or any of the sample and let them conduct screen laboratory testing on you. So if that is done, then it can now be said that, oh, this person is confirmed positive or is confirmed a negative. So the best thing is that when you feel unease, you feel not rest, go to the nearest clinic or hospital for testing, and that's how we can go about that.
Are we really prepared? Because the World Health Organization says there is no vaccine. It will take about 9 months to have an approved vaccine. What are the other options or precautionary measures we need to start looking at now?
Yeah, to me, when that is said, I just smiling because we have three organizations that are involved, that receive funding for that, and most of the time we discover that none of them are not African-based organization, and it's not even about the vaccine development. How we show the community we even take the vaccine like this one. And that's why I always put it out that you can't do anything and exclude the community and exclude African scientists from the beginning. Because we are the ones that are closer to the people at the community. We are closer to them. If you can produce anything, are people going to take it? Now they are still saying that they don't believe it is real. That it's the Western world that brought the pathogen into them. So the question is, why do we have to leave our problem in my house to another person to solve? So, but pending the time, that time, what we need to do is just to enlighten them, like this science communication that we do, that this thing is real. When you suspect anyone, the best way to care for the person is to take the person to the hospital, to the clinic for laboratory investigation. And once that is done, then the person is confirmed negative, then you can still move on. But the truth about it is there are some studies that have shown that even when you are confirmed negative, there is a weeks that you need to stay because you can still be shedding the virus that can also infect other people that come in contact with any fluid, any part of your body. It's not airborne. That's one thing. It's not airborne disease like COVID-19. But this one, there must be contact, body contact with either fluid or any other thing. And that is where the problem is because people are dying, somebody is bleeding, about that now classical stage, and you're there to take care of us. And truth is that you can't have any sick person in your household and you leave the person untouched, uncared for. So, but now that we have made them to know that okay, you can wear glove, you can wear all this for you to be safe a little bit, it makes the work more better than what we have then.
According to Dr. Tedros Ghebreyesus, the Director General of the World Health Organization, the only way to beat this outbreak is through close partnership. Working together under the leadership of the affected countries is one coordinated effort guided by a simple principle: one plan, one budget, one team. Containing Ebola depends on political commitment sustained by financing. Is this possible with the current structure, especially when the health sector is experiencing the large-scale funding cut?
Yeah, it's possible once we all rise to the task. Like, it's everybody's just, you have to bring something to the table. It could be your technical expertise, it could be your knowledge, it could be your money, it could be, at least for the past 3 weeks now, my team with some other team now in Nigeria has been working on candidate vaccine for that particular strain. And I know by next week, everything will be ready for preclinical trials. So we were not waiting for funding. We have the methodology. We have been doing that. We did in the era of COVID, and that's why. So it's a system that it's everybody should key into it. Look at what the president of Nigeria did yesterday, committing almost like 10 billion naira to the fight of Ebola for us to be safe as a country, and putting some airlines in place for you to check for temperature, every other thing. And I feel that is a collective effort. And I have seen people in the affected community going there, going to the market, talking to it about them, both in their local dialect, in other languages, so that the message can be well represented and passed across to them all. I felt that's the way to go, a collective within Africa, African Union, African CDC, African Development Bank. Let everybody come together and put in their resources, and let's fight this pathogen together. Yeah.
All right, back home here, what are your final words to viewers, Nigeria as a whole, in terms of prevention?
Yeah, what I would tell people is that, being an experienced traveler too, when we have put some mechanism at the land port, at the seaport, at the airport, if you are a regular traveler, if it is possible not to go to those areas where cases have been reported, if it is possible, fine. And if not possible, by the time we have some health port authorities asking questions, giving you form, please be truthful with the form. If they request, have you experienced this sign? Have you made this place? Please be truthful, because that is the only way we can safeguard our health in the country. It's not about you alone, it's about everyone. So if you are truthful, nobody is labeling you, but it's going to help us to do appropriate contact tracing in case of anything. And in truthfulness, we can win this war together. So that is it. Then for now, until the vaccine is developed and other measures are being developed, the preventive measure, looking at infection prevention control measures, we should try to look at it, wash your hand regularly, and ensure that you know where someone is coming from. I think with all these, we are good to go. And our health system, the Minister for Health Party, is quite doing something good. And I know that the director of DG for NCDC, they have been coordinating a lot of harms in ensuring that Nigeria is safe for every one of us.
All right, be truthful with your health history. We can win the war together by adhering strictly to all the precautionary measures. I wish you all the best in your clinical trials with the Ebola vaccine, Dr. Oladipo Kolawole. Thank you so much for your time.
Yeah. That would be a animal trial. So it's a preclinical trial. So it's after that we hope to get something interesting and move on with that with other partners outside the country.
I wish you all the best, all the same, Dr. Kolawole, you and your team. I wish you all the best. I have been speaking with Dr. Oladipo Kolawole, an Associate Professor of Infectious Diseases, Molecular Virology and Genomics, Department of Microbiology at Adeleke University, Ede. He is also the founder of Helix Biogen Institute. Thank you so much, Dr. Kolawole.
Thank you so much for having me. See you another time. Huh?
Sound Health continues with trending health report from around the world. Please stay tuned. program has been Sound Health on Lagos Television, and we have been looking at preventive measures, how to prevent the Ebola virus from spreading in Nigeria. Remember, you need to adhere strictly to all the precautionary measures. Wash your hands thoroughly with soap and water or hand sanitizer. You need to also report symptoms early enough to the nearest health facility around you. For comments and inquiries, or you have topics you would like us to treat, please send SMS to 0803-582-6603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.